Hello everyone, and I'm going to be switching on my video so that at least you can then know that it's not an AI that you are interacting with. It is a real human being, flesh and blood. Hello everyone. I am Marlon-Ralph. I'm a medical doctor and a digital health consultant. And it is my pleasure today to welcome you to this one of our events that we are hosting as the Zimbabwe Digital Health Society. Maybe whilst other people are coming in and as our speaker is getting ready, it'll be my privilege to let you know more about the Zimbabwe Digital Health Society. What we really are or are building is a society that is mainly a community of practice. There are many of us that have been involved in digital health or e-health for a long time, and we're also seeing that the sector is growing in Zimbabwe as well as abroad. And what we then need what we felt is needed was then a community of practice where people that are involved in the sector in Zimbabwe can get to interact, so that we facilitate collaboration, so that we engage with each other, we share ideas, we learn from each other, we try to cure that pilotitis, to kind of avoid duplication of efforts, so that we just then know what's happening, and together we also can then maybe present a more unified voice that can then guide the ministry as well as the government in what they are doing in terms of creating the enabling environment for digital health. So that's what we are. So through events such as this, it is to gather people from diverse backgrounds, whether you could be someone in the health field, you could be a software engineer, you could be someone who's running a startup, someone who's from a corporate, an NGO, or even a policymaker. It is just then to have this environment where we have people involved in the sector engaging with each other and sharing ideas. So that's what the society is about. And we've had a few events, and now it's really the time to gear up and go to the next level. And so we are grateful and excited to see all of you coming in. And I think you already registered, so we have your email addresses. So we'll be notifying you of all the other events, even those that are not just online. Online is this beauty that allows us to connect from wherever we are. But sometimes it's always good to then meet in person. And what we hope is that even through these meetings, you can then get to meet other people that are in your area, and then people can then meet up for coffee and tea and whatever it is that people use when trying to lubricate difficult conversations, and then maybe that can then help more collaboration that is needed to take this fledgling industry to the next level. So again, thank you for coming. Right. So we're going to have our speaker, Dr. Jokwiro, is here, and then after that, we're going to have ample time for Q&A. I see we have there are people that I know that are not just in Zim, people in South Africa, people in the UK. Hi, Dr. Samir, how are you doing? I also am in the UK at the moment. Prof. Nyasema, good to see you. And others. Let me not turn this into a Star FM introduction where they start calling out people one by one. But it's just exciting to see all of us coming together in our different backgrounds. Dr. Jokwiro, since sound check is on, I think I might be yielding to you so that you can then get us started. But before we do that, let me introduce you. So Dr. Admore Jokwiro is someone who is very well known in the e-health or digital health circles, a medical practitioner who's one of the pioneers of telemedicine during his time as a district medical officer for Nyanga district. He took it upon himself to set up a telemedicine solution that got to serve a lot of people in his district. Something that he did with his own money, with his own initiative, and it proved results. And from there, he hasn't stopped, and he'll get to talk a lot more about his experiences and the wonderful work that he's doing now, and all the places that he has been. He's very well connected in Zimbabwe and around, and we are happy to have him as part of the society. So, Dr. Jokwiro, okay, let me stop sharing so that I give you the access so that you can start sharing. Please, over to you, sir. Okay, let me.
So confirm you can see my screen.
Yes, sir.
All right. Thanks so much, Marlon. My presentation this afternoon is not going to be very long, but I think it's really just get to us as a society to have some foundation where we can speak on and maybe start beginning to build a shared vision. Thank you so much for the generous introduction, Marlon. But for the records, you mentioned things like using my own money and also being well connected. There are colleagues on the call that I interact with a lot. Dr. Samir, Kumbirai, Adele. Please, you should be able to quantify the well connected, that I'm well connected to you, Doc. So if they need anything, then they can always reach out to you directly, Dr. Malon. But it's been a pleasure working with you. Obviously, I think we have traveled the journey together, and we would not have been able to achieve some of the things that we have if we had not collaborated with you, which is what I think this society must actually help us to be able to achieve. And I'm quite excited that, I mean, this conversation has started and is going to grow, and you have been driving it, which I am really grateful for. So for the purposes of today's meeting, I prepared, I think, about 15 slides just to touch on the state of digital health in Zimbabwe. And here we are looking at the progress, we are looking at the challenges, we are looking at the future directions. So I would like to start off by just, outlining the agenda. I will just give an overview of the digital landscape as it is. I will talk about the public sector initiatives. I will talk about the private sector innovation. I will also talk about our academic programs and research, and then broadly talk about the enabling environment, whether it's actually enabling or, I mean, we require much more to happen. And then I will close off with a few next steps and recommendations. So when you look at our national health strategy, we have a digital health strategy, which is running 2021 to 2025. It's in its last year. I don't know if it is going to be extended because, I mean, a lot of the times that's what we have heard. And also, if you were to evaluate, I mean, the achievements, I was part of the team that drafted the current digital health strategy at national level, and I have a strong, I mean, appreciation that we have not, I mean, essentially achieved much, adequately for what had been planned. So some of the recommendations are still, I mean, very valid. So I really don't know, I mean, whether the ministry is going to extend it. But prior to that, there was what we called an e-health strategy. And then as we go to 26 to 2030, I think there's also consolidation around developing a vision which can then contain the strategy and the policies, etc. But I think these strategies, when you look at them, they are always talking about championing universal access through digital health services. They talk of integrating health information systems. So you will find terms like interoperability, health information exchange, unique identifiers. You have those as, I mean, the elements, the building blocks. And fancy also things like data-driven decision making, capacity building for digital health workforce, and enhanced healthcare quality and efficiency. So these are part of the pillars or the strategic objectives or principles within the current, I mean, strategy. So how much have we done? Maybe we talk about what we have at the moment to understand how much we have done. So I try to make, like draw some connections between private sector, public sector, and came up with what I call could be key stakeholders within, the healthcare sector. So in the private sector, obviously the Ministry of Health and Childcare is the biggest client, the biggest stakeholder, managing, over 1,600 facilities countrywide, hospitals, clinics, tertiary facilities. So definitely, the Ministry of Health, the government is actually the biggest player in digital health. If we were to, go by volume of patients, like patient volume in terms of transactions that happen. Then we have private sector providers. Forgive me, I could only talk about Zimbabwe villages, largely because we don't have much information about initiatives in the private sector, although we know people like Maisha are doing a lot, but not, obviously well documented. And there are other players who are developing systems, but it's difficult to speak because publicly, when you go onto the internet, you can't really get much. And this is something I think the society must be able to help us with to create more collaboration within the private and public sectors. Um, the Ministry of Information and ICTs, I think, would also come up there on the key stakeholders, with Potras being a key player who we have worked with in the past, and we still, are doing some work in digital health in Zimbabwe. We now have academic institutions like the University of Zimbabwe and NAST, and I think MSU offering some kind of, degrees around health informatics, data science, and information systems and information science. So I think those have been players as well. Then we have development partners like PEPFAR, CDC, ZimTTech, who are supporting the National Electronic Health Record, which is Impilo. So you find that, with the way we are placed in Zimbabwe, you would want to look at patients as the center, or as the key connection, and then how these systems are actually supporting, patient care. So I think if we were to list, stakeholders, those could be some of, the key stakeholders. MNOs, I think Econet through Maisha Health and Dialadoc, I think are very well documented or spoken about, but maybe not documentation. But I think you would be able to share more insights, Dr. Marlon, having, led those initiatives. But that's I think the involvement of MNOs, which obviously I think we would want to see more. Is in other countries like Safaricom and your Safaricom's and Airtel, MTN, they've done. So if you were to talk of challenges within our digital health landscape in Zimbabwe, number one, you could be talking about things like infrastructure limitations. So power, connectivity have been issues. Power, we have had the Solar for Health project, which I think has helped, but to what extent, I think also we need, to dig deeper to understand that. Connectivity issues have really been quite topical. Even from the time that we started doing telemedicine, we really had challenges using our satellites, Ka band. But thank God we now have Starlink. And I think issues around connectivity are really going to become next to, non-issues for as long as we have power, because obviously to get the satellites, up, you need connectivity, you need power, sorry. So I think that's the issue. Mobile connectivity wise, 4G, we talk of it, but it's not, obviously in areas, in all areas, we talk of, 5G, but I think mobile connectivity, our penetration is still around 70 or so percent. So I would really, say if I were to advise, obviously I think Starlink is a real quick win regarding, connectivity issues. Then digital skills gap among health workers. I think this is something that is quite topical. In our experiences, in some of our implementations, this has been actually a barrier. So we have recently come into a partnership with an organization called Nurse on Call, which is offering free digital health training for nurses, and which is something that we think is commendable. Is investing, in the future. And the good thing also is the universities, especially University of Zimbabwe, NAST, and MSU. I think we have started seeing programs which can really power, health workers as we go into the future. And I think we have some of the students on this call. And when you look at funding constraints, I think this is a topical issue. And when PEPFAR USID pulled the plug earlier on this year, I was really thinking what is going to become the future of some of these initiatives. But I think PEPFAR has been able to retain its funding. But whether it will keep funding, I mean, digital health systems like it has done before, I don't know. But I think funding constraints using national resources on their own, I think those have been key issues. So just to touch a bit on the National Digital Health Strategy, which is expiring end of this year, which I talked about, some of the key pillars look at infrastructure. And infrastructure, that's reliable connectivity, which I'm saying, I think with the arrival of Starlink, definitely we have a lot of hope. And then there's hardware for healthcare facilities. And when you look at hardware, I think some of the conversations that have been happening are around cloud servers and on-premise servers. And I think our Impilo system is still very much reliant on on-premise servers, which I think has its own disadvantages in terms of cost, in terms of maintenance, in terms of, uptime. So that's, I mean, something that the strategy touches on, and it recommends, I mean, cloud servers, which can be secured, I mean, using the standard protocols. The strategy also talks about data systems. And this is where, I mean, you look at things like the patient registry, the electronic health records, the private sector systems, exchanging data, standards. I mean, single patient record, unique identifiers. So these elements are there in terms of, plans and suggested roadmaps within the strategy. And I can share a copy for those, I mean, that have not come across, this document. Capacity building. This is where we look at what is Zimbabwe going to need, what is sort of the competence required for a nurse, I mean, in digital health or in the systems, I mean, that we are talking about. So there is a pillar on capacity building for health workforce strengthening within the current digital health strategy. And I think people can pick ideas around what they can be able to then formulate in terms of programs, in terms of interventions from the strategy. There's governance issues, which looks at policies, which looks at standards, which looks at regulatory frameworks. So you see that, I mean, in the private sector right now, when we talk of Zimbabwe, and I've had these conversations with colleagues, that the private surgeries, the private healthcare sector, there are many systems which are being utilized, but these systems cannot move, I mean, data obviously from Dr. Marlon's surgery to Dr. Jokwiro's clinical practice, even referrals. I mean, and I think our patients have not been able to enjoy the sort of benefit which must be driven by things like a single patient record, or at least interoperability, allowing my information to move from place A to place B to allow continuity and a longitudinal patient tracking. So I think the society, as in us, have a big role in terms of trying to help our government, our stakeholders, to be able to actually open up opportunities for us to use standard, electronic health records. There should be some form of certification, I think, around what is, adequate, and so that we can have systems which can then have APIs and talk to each other. I'm not insisting on using one information system within the private sector, but I think we should have some form of regulation which guides, I mean, what kind of a system can be acceptable, security, usability, and I mean, information system, information systems, interoperability, and some other things. So I think this is an area which needs a lot of work, and which I expect that the society can actually take up, because this also talks to advocacy, production of policy briefs, evaluating present, systems, and building, identifying gaps and consolidating. So I think that's a big issue for the society in terms of, governance. Then, of course, the icing on the cake is digital health services and applications for patients. So everything that we do around health, we are trying to obviously improve the outcomes, the quality of health, the quantity of health. So whatever, things we are planning within the digital health strategy, they are then eventually consummated as apps or services. And this is, then, so if the foundations are right, I think at the layer of services, basically, this is actually people just ripping off on their investments. So this is the sort of strategy framework, how I look at it in terms of, the digital health strategy. Then another key public health sector is the Impilo electronic health record system. So this is the system which the government has been working on, I think, from as way back as 2015, to be able to provide and enable digitization of records within the public sector. I will share that this system, when it was originally, conceived, it was about solving challenges in capturing HIV and treatment health records for patients within the public health sector. So the system has been built with that mindset initially, and then also it was also thought and it was planned to solve the use of, the reduced papers, the paper systems, the registers, the tally systems, and everything else. So it had a strong bias towards reporting and digitizing registers. And I think this is what initially affected the progress and development of the system. So it was originally supported by ICAP, but now it's being supported by Zimtitech, but the main funders have remained the same. It's PEPFAR, USID, CDC, obviously, it's all PEPFAR funding. And then there's been Global Fund, there's been like funding things like solar and other things. And then there's been, the government of Zimbabwe funding as well. So you will see that now the system has been iterated, pivoted, and it's now, aiming to address the general services which are being offered, at primary care level. So largely the system has remained at primary care level, which is the government's public clinics, and it has not really taken up at things like district hospitals, provincial hospitals, or central hospitals because of its design in terms of what it is, doing. So you will see that some of the key modules are related to HIV work, like I said, case-based surveillance, HIV testing, monitoring people on antiretroviral treatment, and it's used by, nurses, administrators, and ministry officials. So in Pilo, I think there is a war repository, which I can get a link and share as well, if you want more information on Impilo. But I think its capabilities is have not yet been fully, consummated, and are largely supportive of, the private sector use cases, so the public sector rather use cases. I'm not a prophet, but I don't think it would be able to implement this in the sorry, in the private sector, given, the design of the system in its present state. So what are some of its capabilities? Real-time clinical data capture for as long as you have solved the power and connectivity issues. And I think these have been some of the major challenges. HIV testing and case-based surveillance, this, like I said, it does well because this was the original design in terms of what it was needed to be able to do. Patient management and care coordination, I think we are yet to really consummate or get the care coordination part. Patient management, I think, yes, there's some clinical decision support within the system, which can help our primary health care levels, like our primary care nurses or our rural, health center nurses, to get some insights. And there's analytics and reporting, especially the reporting part. Like I said, there was a lot of bias towards digitizing registers. And so when Impilo was first conceived, it had, those merits around reporting. Analytics, I think these are things that are still, being built. Some of the things maybe that I don't mention there is issues around duplicates, around patient registration. A lot of effort has been made around addressing that, and I believe they are building a patient registry as we speak, and hopefully to be successful. So lab system, pharma system, those, some of those elements are there within the Impilo system. Then there is something else which we call District Health Information System, which is the second version. And this has been the central repository of aggregated data, and this repository is used by the ministry for collection and analysis. So DHIS2, and we use the web application in Zimbabwe, is the system which captures the paper records or the paper tallies. So a rural health center comes up with a monthly tally, say, of patients seen, services provided, medicines dispensed, and it's disaggregated by age, gender. And this disaggregated data is then fed manually into DHIS2 at district level, and then the provincial structures and the national structures can be able to see this data. So unfortunately, the rural health center, which actually collects the data and submits, has no access, to the system to really drive data-driven decision making. And I think this is the hope that with Impilo, people will be able to finally crack and solve that. But DHIS2 remains very much alive, and it supports the Ministry of Health's monitoring and evaluation department. And I think that's what I would say regarding DHIS2. So there's been efforts now to integrate or connect Impilo with DHIS2 to allow automated reporting rather than the clinics, submitting those tallies and stuff at the end of the month. I'm not too sure in terms of the progress, but I think when we get some of our colleagues within the society from the government sector, they could be able to give us more insights around the progresses regarding DHIS2 as we speak. Um, and then the other things that you look at is the issue of standards, the issue of, HL7, fire, Loink, SNOMED, etc. I think some of the systems I think Impilo has, taken up some of the standards. Whether it has taken everything, I'm not so sure, but I think ICD-10 or ICD-11 should be available within Impilo. Now I touch on some of, the challenges and solutions, which I said, power challenges, power supply challenges, they've been quite topical. So electricity supply, even in urban areas in Zimbabwe, has not been so good and so consistent because of challenges related with power generation. And you can imagine, in rural areas, how much of a challenge it has been. There's been a Solar for Health initiative funded by UNDP, which I think has gone a long way in assisting, but we also hear of thefts of some of the gel batteries and non-replacement or servicing of some of those, affecting certain clinics and resulting in downtimes at various health centers, rural health centers. There's been also a question which what I touched on, which is in the national health strategy around cloud versus on-premise servers. I think because of security issues, people have vouched for on-premise servers when Impilo was being conceived, and I think some of these are still remain. I don't think they are yet on the cloud, and I think for me, I think when you scale, Impilo, you would want to really look at cloud servers and ensure that routine security protocols are actually followed. But this, I think, can realize in much savings rather than having on-premise servers, which still can, be accessed and which can, break down, which can be stolen, which can be violated. So I'm more inclined to cloud service, and I would love to hear your feedback, colleagues, on this call around this question on cloud versus on-premise, deployment, whether it's a straight decision or not. I don't know, but I'm inclined towards cloud, according to my understanding. And then connectivity and internet, I think I did talk about this earlier on, and I said emerging technologies like Starlink, satellite internet are really proving to help. So now I touch on the private sector and a bit of the academic sector. And again, forgive me for talking about our initiative, ZimSmart Villages, but I thought it was really, where I have, all the information, or at least a lot of information around what's been happening. So ZimSmart Villages has been implementing for the last, I think, 14 or so months. telehealth, wellness, and remote monitoring. And Zimsmart Villages is democratizing access to healthcare services. And so the key issues is really is accessing consultations, accessing medications, pharmaceuticals, and accessing diagnostics so that we can, drive towards precision medicine. So, given that mission, the Zimsmart Villages work has been centered around rural villages, and Zimsmart is implementing telehealth kiosks inside post offices and some outside post offices, standalone telehealth kiosks. The model is virtual consultations with doctors, nurse-led telehealth kiosks, and central coordination at its office in Harare, which is like the back office. Technology, which is driving this, is Starlink, computers, and then some remotely connected devices like tele-ultrasound, breast ultrasound screening for cancer, transdermal optical imaging, and now we are talking about dermatology use cases as well as mental health use cases. In terms of the vision, the idea is to create as many health access points as possible to ensure that people can live within 5 kilometers, of a health service. And our model is premised around access in terms of distance, in terms of costs, and access in terms of, convenience. So we are looking at, exploring some of those things. We currently have about 19 telehealth kiosks, which are operational as we speak. And our network is expanding. And with Starlink arrival, we are looking at broadening and scaling our service over the next 2 years. We are targeting to cover every post office by the end of 2026. If funding, is availed. With the lessons that we have learned over the past year, we are now in a position where we know what works. We also know what doesn't work, and we also know how we can sustain what works. So in terms of services for Zimsmart Villages, the idea has been centered around primary prevention and secondary prevention. So Zimsmart Villages recognizes that you can make a bigger impact if you prevent generation or genesis of conditions like hypertension, like diabetes. It's good to go out and screen people for diabetes and hypertension, for cancers, but it's also good to be able to predict who can become hypertensive in the next 5 years, in the next 10 years, and begin to take measures to be able to address that. And this is where the power of artificial intelligence comes in. And we have started looking at our data sets and saying, how can we have data sets which may help us say to predict the risk of prostate cancer? How can we have data sets which can help us by using biomarkers to predict hyperlipidemia? So this is the work that we are now seized with, and we are really excited about the future in terms of digital health from that perspective. Within the private sector, digital health initiatives, not just in Zimbabwe, but looking Africa-wide. I also tried to just list some of the applications that we know have been used in other countries because of the lack of documentation of some of our own local initiatives. So Dr. CADX, Pulse Health, ourselves, the Zimsmart Villages, Maisha, Dialogue Doc, I think CMAS also has a service, and I think First Mutual Health was trying also to, have another service. So they are isolated, they are numerous. I think Marlon has previously done a paper or, a white paper or, an article on pilotitis, which I think is now an established, a condition. And I think as a society, we need to actually confront pilotitis and see how we can help each other. Kumbake is another, a startup that we have seen. Then from Nigeria, Mobi Health. Those are some of, the startups that we see that are working within the health sector. But there are plenty, there are many. We are talking of things like also pathology, digital systems, like Path Health, digital systems. So yeah, there's a lot, to talk about. Coming to the academics in Zimbabwe, I think we have seen the University of Zimbabwe set up a bioinformatics department, which is offering undergraduate and master's programs. We also, know of a health informatics training and a research advancement center, which I think was housed within the university. Whether it's still operational now or not, I don't know. NAST is also degrees in data science as well as information management. And we also have the Zimbabwe medical students talking about informatics, and also the ZMain, which is the Zimbabwe Medical Analytics and Informatics Association, which has been doing quite a lot in terms of advocacy, in terms of opening up opportunities for fellow students who are taking this program. And I think you will know the young men like I think Forgive and his team. They are trying to promote an enabling environment, which is what I then center on as I begin to conclude this discussion. So when you talk of an enabling environment, I think there are important elements which, when we are looking at Zimbabwe, we ask ourselves, do we have policies? So the regulatory framework, is it coordinated? So we talk of the digital health strategy, we talk of, acts like the Public Health Act, we talk of bodies like councils, regulatory bodies like the Medical and Dental Practitioners Council, Nurses Council, the Health Professions Authority, ICT authorities like POTRAs, the ministries themselves. So we see that in the Ministry of Health, we now have an informatics directorate, which is, good progress. We see that, within the Medical Council, we have a policy which came out of COVID-19, which again is good. We see that at the Health Professions Authority level, we now have, some kind of temporary arrangement, compromise, so to speak, around licensing telehealth services. So I think there is progress, but it is not, obviously moving fast enough. But I think the elements are starting to appear. So in terms of standards and guidelines, I think this is the way we have one of the biggest gaps. I would love to see the Digital Health Society really fronting standards and guidelines development, because we cannot expect non-practitioners of digital health to actually lead this effort, because they would only be thinking about security, about shutting down services, about not being flexible, because according to their knowledge, there is a risk with electronic health systems. But who has ever questioned the risk around paper systems? How those registers are stored, how those paper records are stored? I think I equally also shudder to think what can happen to them. So I feel, the society needs to have an agenda around fronting standards and guidelines development, policy briefs, engaging the authorities to be able to drive, those aspects. Another area, which we look at is obviously implementation support, and this is where we look at funding. This is where we look at health workforce. This is where we look at issues around capacity building, issues around pooling resources, and issues around, for example, as we speak right now in the private health sector, we probably have 50 or more systems which are being used by practitioners. But if you look at the cost in terms of development, cost in terms of maintenance, there could be savings if we were using one system, for example. And then things could be cheaper for the doctors. Things could then also be cheaper for patients, because sometimes these costs are then transferred. So I feel like, again, I would love the society to look at things like that: interoperability, adherence to technical standards, evaluation of platforms, data formats, system compatibility, APIs. I think those are real issues. Monitoring and evaluation. I think we will not really possess enough health information systems evaluation capacity. And this is where the society should also be able to come in to be able to provide such trainings. There are some of us who probably have experiences that they can share with colleagues. But I think the idea then is to develop as many practitioners as possible, because we cannot, do so much as individuals, but much more together as a society. So public-private partnerships, very key. We have learned from our own case study working with Zimpost that as much as it looks like an white elephant, but there is still life in some of the systems which can be harnessed for good and be able to provide cheaper health services. So I now come to my last slide, where I just touch on possible next steps to advance digital health in Zimbabwe using a coordinated approach, focusing on infrastructure, capacity building, policy, and partnerships, because these are the essential ingredients around how we can actually be able to harness and be able to scale digital health and be able to champion universal health coverage, whilst at the same time strengthening primary care and even care at higher levels. Only recently, we watched a video of a transatlantic operation of a patient in Angola who was operated by a doctor robotically and remotely in the US. So infrastructure, there is no excuse. We need power, we need connectivity, and we must prioritize our clinics, starting with the high volume ones. And these health systems cannot work just at primary care level and then become absent at provincial, at district, and at national, levels. Because when we want to talk of single patient record, if I transfer a patient from a rural clinic and send this patient to Parenya through Nyanga District Hospital, through Mutare Provincial, I need to know what happened in between for the sake of continuity. So I think this is what we must be able to look at boldly. Workforce capacity building, we have organizations like Nelson Co that I spoke about, who are beginning to offer free tuition for digital health, which I think is a key investment as we go forward. But we want more partners to be able to come in and to be able to, promote and advance these initiatives. Public-private partnerships, from our own case study as Smart Villages, I think we have learned a lot that it is possible and actually that it works. Of course, we are still a long way from where we want to be, but the lessons we have already learned I think are important. And then last but not least, an enabling environment, policy and governance. We should not run away from regulation because we want to ensure quality. In fact, we would want ISO certified systems as standards. We want to be compliant, but at the same time, the existing legislature or statutory instruments or other legal tools should also not be restrictive, and they must be objective, and they must look at data governance, they must look at interoperability standards and insist on them. They must look at secure health information exchange, because those are the elements which promote health. Imagine if we could tell how many diabetics we have and where are they, what resources would we be able to channel. Imagine if we could be able to predict outbreaks by studying previous patterns and seeing and having some thresholds and then alerts being timed to say we are now getting into a malaria outbreak. We need to pre-position these essentials for testing and for medications. So I think there's so much that can be done in Zimbabwe, and like I said, I'm happy and looking forward to the conversations which are going to start as the society. So that is it, ladies and gentlemen, in terms of what I could share around the state of digital health in Zimbabwe. Thank you very much, Dr. Marlon. I now share the platform back to you, and thanks for this opportunity.
Thank you very much, Dr. Jokwiro. I think all of us we can express our gratitude in the comments and in the reactions. And what you did rightly was to give an overview for someone who's trying to understand or get a grasp of where we are, what's the situation, what is it going to do. You rightly did so, and you touched on all those areas. Each area, I think, going forward is what we'll target each area to do a deep dive on each area, because there's lots to cover. If we were to look at private sector initiatives, you mentioned some, but there's a lot more that I know of there's a lot more from even people that are joining this call that we don't know of. So we are as a society going to grow that so that we can have a way of really mapping and identifying and shedding the spotlight on all the initiatives, on all the innovators and entrepreneurs that are invested in this space. There's a lot to discuss around infrastructure issues, electronic health records themselves. A lot of players that are involved in there, like you mentioned, the need for standards, the need for interoperability. That's something that, as a society, we should be able to do without necessarily having to wait for government regulation and policy. Yes, government regulation and policy can be enabling, but as private sector, we also can just lead the charge that amongst ourselves, the various systems that are there on the market, we should be able to allow that interoperability to happen without waiting for the government stick to beat us into that into conforming with that practice. So what we hope to do is in the future meetings to get to dive deeper into all of these areas, because in 1 hour we could not exhaust them. So we're grateful, Dr. Jokwiro, for then giving us an overview of all those areas, and a recording of this meeting will be made available. I think the easiest way to access is we'll put the links on our LinkedIn. I shared a link to our LinkedIn page, so please follow the society, get connected with the society, and then you'll be kept up to date with all the topics that we have. One of the things Dr. Jokwiro really mentioned, a lot of things that the society should be pushing for as we are trying to advance the digital transformation. And what we will be aiming to do is these conversations that we get to have, these interactions, we get to hear from people that are actually doing digital health on the ground. So these are insights that you might not be able to get elsewhere, or they might not be well documented in terms of how like the digital health strategy is and so forth. So this is going to be that unique space where you can get some of these insights. So please, the floor is open for questions, and if there are people that have any questions, let's see. You can put them in the chat, or you can even, like raise your hand, and then you'll be we'll allow you to just go ahead and ask any question or comment. I have several comments. I think as others are putting their comments together. Regarding the Zimbabwe digital health strategy, I know there was an effort to kind of do a midterm review of the digital health strategy. And I think that was being led by researchers at the University of Zimbabwe, where they were looking at where things were around maybe 2023. And I'm not sure if that report was then published. So it was like a midterm review, then focus to then look at what they should maybe make their priorities, so that if they couldn't achieve everything, this is what they'll then identify things that they'll then focus on. So there was work on that, and that was going to be tied with a maturity assessment, where they can then say, oh, as far as Zimbabwe is concerned, this is where our digital health system is. Is it nascent? Is it emerging? Is it advanced? Is it now developing? So yeah, so I'm not sure if that effort was published. Prof. Nyazema, please go ahead. I recognize your hand.
Thank you. Thank you very much, Dr. Nyakabao. And thanks, Dr. Jokwiro, for the excellent presentation. If I can put you into a comfort zone for an old geezer like me, please don't be discouraged. We have come a long way. I remember when I was the chairman of EcoWeb, I don't know whether you recall EcoWeb, during the early days of HIV. And I set up a platform where people could exchange how they feel when they were suffering from HIV and so forth and so on. Then I can tell you also something that will interest you. At the time when we got licensed for Econet, with telecoms, without mentioning a name, we were in court And somebody said, Zimbabwe was not ready for this technology. We have come a long way. And honestly, what you're doing is out of this world. My question to you is, what do you think is the role of the consumer, digital health and the consumer? I think we need information on how the general public feels about it, because then that filters in to the kind of policies and regulations and so forth and so on. Because I'm thinking, when we talk about regulatory authority or regulatory framework, one thinks of regulatory science and so forth. So there's a social aspect to the regulatory issues. So it would be important to just have data that would tell the powers that be that this is how people feel about digital health. I need to hear your comment. Thank you so much.
Thank you so much, Prof. Nasem. Dr. Jokwiro, would you want to tackle that question? Maybe I can then follow after you regarding what the consumers, what they are saying regarding all of this.
Oh, yeah. So I think sharing lessons from our implementation around the role of the consumer, or also the feedback of the consumer. We actually conduct satisfactory calls on purpose, so that we keep learning from our clients in terms of what areas we can improve and how they feel about the service and everything else. I can say that in terms of sentiment analysis, largely the comments have been positive because of, the convenience, I think, of where we are offering these services in remote areas like Chirumanzu, Nyamaropa. So I feel like people appreciate, because of the convenience. Then also in terms of, patient feedback around improvement. Not so long ago, we had, some interviews with our clients at one of our telehealth kiosks in the Headlands, and we were asking why they chose to use our facility as opposed to the government clinic or council clinic, which is about 3 or 4 kilometers away from where we are. And it was, the one of the patients saying, I saw that when I came to this telehealth kiosk, my condition started to improve. Which was not happening when I was previously going to the clinic. So obviously the interaction with doctors helped in terms of controlling that patient, I think, had congestive cardiac failure. So this is a 60-year-old patient who was saying this. And for me, I think this is when it was striking to say, actually patients making conscious decisions to come to a place where they where they can pay but then get service which they then say is satisfying them. But what exactly is the role of the consumer in all what we are talking about? I think our systems, or the way I look at it, is really the saying it's patient-centered. So patients first, then data honest. So I feel like we need to appreciate that patients actually own the data that we are generating. And I feel like we need to ensure that as much as we are talking of an enabling environment, we also have to educate our patients to become digital health literate, and they can access some of these, patient reports, some of these, recommendations. They should be able to be active participators in the ecosystem. That's my feeling in terms of the patient role. Whether we have achieved it now, not yet, but I think going into the future, this is where I say I think patients should, own, the data and the service, and we drive delivery. So Marlon, I think you can add, but this is how I look at it.
Indeed, I won't add much more because I'm also cognizant of our time. But I do agree with your points. There's need for more people to use. The thing with healthcare is we have patients. I think there's a difference between patients and then consumers. and there's a role for both. So from someone who's from a patient point of view, in their time of need, in them being vulnerable, my experience is that people are open to solutions that allow them to get care in a more accessible way, in a way that is cheaper, in a way that is faster. So whether it is by technology means, people will be open to it, because with our population not having health insurance, and the economy being so tough, if there's a way for them to get care that is more affordable and more accessible, they would really appreciate that. But like I think someone put in the comment section that we're seeing a lot of people using social media. So that's again, I guess, where education is needed, so that people know how the safest way to use social media. Don't just consult people on WhatsApp platforms, and then you talk about your health issues there. Don't use the general Dr. Google that you don't know about. In terms of health practitioners, we do have policies from the Medical Practitioners Council that kind of advise us on how to use social media. But then it is the consumers, it is the patients, the general public that does need some digital health education, and I hope we'll get to do some of that. There's a question around. There's a question from Tafara about how to, if you're developing a system, how can you get it appraised or evaluated? So currently in Zimbabwe, we don't have a law that or policy that makes that mandatory. I think I've seen Kenya maybe have that. So without really kind of like calling for such a law, what Dr. Jokwiro mentioned in his presentation is the need for some standards for having that acceptable level of a system. So I just shared in the group a link to an article that I wrote with just maybe some 10 things for people to consider as they develop their EHRs. But that's again a perspective that we'll get to build as the society. I believe in guidelines that if we have a clear guideline of saying this is what your system should be, then everyone then can conform to that guideline without necessarily having to kind of come in with a stick that says, here's a law, everyone do that law. What tends to happen is the market dictates. If your system is not interoperable, if it has inconveniences with that, then people will shun that and go with systems that offer more care. So yeah, according to the time, plenty more questions, plenty more interaction that we'll have to do in the future. Please remember, there's the link for this video will be on our LinkedIn. Follow the page. You get to keep up with the updates there, and we're then going to be doing more talks that will then take one area and we'll do a deep dive, whether even if it's in the academic sector. Dr. Jokwiro mentioned about digital health skills. I know several initiatives. He even mentioned one that is looking at how it is that we can grow digital health literacy and skills amongst health professionals. So there's a lot that we could dive into, but really let's show our appreciation and gratitude to Dr. Jokwiro for giving us an overview, which is a great way to get started. And in the future, we hope to hear from many of you on the course as you share about your presentations. If you also want to lead a session, please get in touch, and we'll organize. We'll be very interested to hear what your startup or initiative or program or research is about. Then we'll get into it. AI is another exciting field, and yeah, we can also get to do a deep dive on how AI is being used for healthcare, using as Zim example. So it's a lot more to discuss. So ladies and gentlemen, thank you very much for attending this first meeting. And please do keep in touch. We'll keep you updated on every meeting that we have, which we'll do on a monthly basis. And like I said, we hope to hear more from you. And then other events that we'll do, you'll also be invited and welcome. As much as possible, we want to be able to meet in person on the ground. So thank you very much, everyone. Thank you very much, Dr. Jokwiro. Have a good rest of the day.
Thank you, Marlon. Have a good day. Thanks, everyone.